Well, hello again, everybody. This is Steve Spinner with New Horizons Marketing, talking about the Lasso product that we've got out there, the Medical Savings Account that has a zero premium product going on a monthly basis as demanded by CMS, as well as a deposit and a higher deductible healthcare product. No networks issued whatsoever. One of the things we wanted to go over, some of the things that we've been talking about to certain brokers, is that the ease of use with the e-app. And so that's basically what we're going to go through today. We're just going to cover it a little bit. And we start with the face page of www.lassohealthcare.com. It says, as you pull up the first page, you'll see this screen right in front of you where it says your money, your choice. And as easy as it is, I am going to put a dummy in here. I won't name it Steve, but here we go. We're going to put down a zip code, and we're going to merely click on this red button toggle off to the right of that where it says Enroll Online. Once we hit that, we're going to see this screen pop up here, and what it's going to do is it's going to make some automatic adjustments to both the premium and the deductible. Now, most of what you've heard me say has been based on a full calendar year for 2019. What I mean by that is, yes, the zero premium stays right there, but a lot of people have heard me say that it's a $2,520 deposit and it's a $6,700 deductible for Region 1, which is where our zip code is at for right now. As you can see, the deductible is not $6,700. It is $6,280, and you can see our deposit is not $2,520, but it's $2,100. The magic little number that we need to remember anytime you start talking about an MSA is, in this case with Lasso, that for every month that we're not involved during the calendar year with Lasso, the deposit will be reduced by $210. Not only that, but the deductible as well will be reduced by $210. So now we're looking at, right now is a March 1 effective date. So basically it's already coming to understand the fact that I am not going to be responsible for Lasso is not going to be responsible for any of the losses for January and February. So if you would reduce my deposit of $2,520 by $210 for January, $210 for February, that will show you that deposit should be down to $2,100. The same as my $6,700 deductible for the full year is going to be reduced by that same $420 amount. You'll notice that throughout the year, the member responsibility is always going to be $4,180. That is the one constant, as well as the monthly premium of zero that will be in this little screen right here. Once again, it's going to go down $210 for every month that I'm not participating with Lasso during that calendar year, not only for the deposit, but as well for the deductible. So let's go ahead and let's put our agent number in here. And we're going to click on Enroll Online, okay? And we're going to hit the OK button with that. Okay, and so here we go. We got selected plan information. And as you can see, we're not going to highlight this, but it's already been pre-populated. Lasso Healthcare MSA, it's carried forward my zip code. It's already showed my county, which is Macon County here in Illinois. If there's multiple counties, obviously, with a zip code, you will have to make a choice at that particular time. So it is important to understand where your client, what county they reside in as well. As you can see, it's already pre-populated my region as 1. If it was region 2, it would show my deductible at $7,700. If it was region 3, it would show my deductible at $8,700. It also shows what my deposits are at $2,520. And again, this is based on an entire calendar year. Off to the right, you see the monthly premium is always going to be zero based on CMS dictate. The enrollment year is 2019, and my responsibility that I'm going to be responsible for beyond the deductible, at which point Lasso picks up 100% of all eligible expenses for Part A and for Part B, is always going to be for 2019, $4,180. Now, Medicare details. I'm just going to say that my name is Mary Sample. And I do not need a title, but we can go that direction. Sometimes you can put Mr. or Mrs. Ms. Let's put Ms. Obviously, I'm going to call myself a female, and my date of birth is going to be 01/01/1954. Okay, my Medicare number is going to have to be the new Medicare number for our off our Medicare card. And so I am going to make one up. Okay. And my effective date we're going to put down is 03/01/2019. 3/01/2019. Okay, and we're going to move up, and I'm applying for, at this particular point, I am the person listed on this enrollment form, or I am simply helping to complete this enrollment form. And I will sit there, and this is the one that I'm going to click, or it could be as well, I am the person authorized to act on behalf of the individual listed on this enrollment under the laws of the state where the individual resides. And this is the power of attorney. In some cases, we will need one. In the event that there is a power of attorney, that's the selection that you would make at that particular time. Primary residence here, I'm going to put down 122 West Prairie. Decatur, Illinois. Again, it's already going to pre-populate this. It's 217-423-8000. No alternate phone number. We're not going to put an email address in, but this is the spot where you would put either an alternate phone number in the upper right-hand side of that little screen or an email address, which is optional. And again, the next question right there is, do you want to opt into email communications? You may opt out in the future by calling the plan. Just for today's purposes, I am going to say no. Mailing address is different from my permanent address. If I mark this, it obviously is going to pop up another box for me to take care of. I am going to leave my address that I put in here as my permanent address. Okay? And again, we can take a look right here. Please call Lasso Healthcare at that particular number if you have any questions or needed information in another format or language. 8 to 8, 7 days a week, October 1 through March 31st, and 8 a.m. to 8 p.m., Friday, April 1st to September 30th. We do have to adhere to a number of questions that have to have specific answers going forward. In other words, as everybody knows by some of the testing that we've gone through, it asks specifically, will you reside outside the United States for 182 or more days in 2019? This answer to qualify for Lasso has to be no. If it's yes, it's yes, and it's a non-go, it's a non-qualifier at this particular point. By law, the CMS dictates that they must live inside the United States a majority of the time. You cannot have other health care coverage that covers part or all of Lasso Healthcare MSA deductible. Please answer the following questions. Okay, are you eligible for or enrolled in your state Medicaid program? The answer is no. It has to be no. If you're eligible, if you're a dual eligible person, eligible for Medicare and Medicaid, this is a non-starter with CMS as well. Are you receiving Medicare hospice benefits? Once again, the answer has to be no. If it's yes, it's a non-starter. Do you receive benefits under the Department of Defense or TRICARE? Once again, this answer has to be no. Do you receive benefits under the Department of Veteran Affairs? No as well. Do you receive benefits under the Federal Employee Health Benefit Plan? The answer is no. Do you receive health benefits under any individual employer group or union plan? Once again, this question has to be no as well. So Let's make sure we get all of them marked. And then the one catch-all question when it comes to health insurance and Medicare Advantage products is this: do you have end-stage renal disease? And that's answer must always be no with any MA product to be able to be sold. This is the one question where it will not matter if the answer is yes or no. It is not a dictate to whether this product can be sold or not. Do you or your spouse work? And in this case, I'll write no as well. Or let me just put yes, just to let you know that we can do that, is right there. Okay. As we go down to the please select an eligible reason, choose the statement that best describes you. I am enrolling during my initial coverage election period because I am newly entitled to both Medicare Part A and Part B. Yes, that's me. And again, we'll touch briefly on this. There's only 2 times that we can purchase a Medicare Advantage product that is a medical savings account, Lasso. Those 2 times are during AEP. Any age, any reason, as long as they're not end-stage renal disease and as long as they can answer those previous questions. During AEP, any age, 0 premium, the full year, the 2520 for 2019, the 6,700 would be the deductible for 2019. That's fine. The only other time in which we can buy outside that period of time is the initial coverage election period. And that basically means new to Medicare. So those are the 2 times. At age 65, when somebody's new to Medicare, they can sign up for this no matter what time of year. Or if someone's on a group health coverage and signs up for Part B the first time for Part B when they retire, whether it's 68 or 75, it doesn't matter. If they're new to Medicare for that Part B effective date, they can get this policy right here as well. Won't matter when. As you can see, it's already pre-populated. Please select a requested effective date. If we click on this button, we can see that it is the only selection that we've got is for March 1. Okay? Okay, please make sure your signatures match the applicant named above. Okay, please provide the following information to apply for a Medicare Medical Savings Account with Optum Bank. I would simply put my Social Security number right there, and then I would type my first and last name. I don't think I need to put my middle initial in there if I remember correctly. By entering your name below, you agree that we can rely on your electronic signature for authorization of withdrawals or other transactions on your account. And then I have to sit there and click on this, and basically I read this. So it's just a matter of going down a little bit about what you understand with the relationship between you, your client, and Optum Bank. If I accept those terms, then basically it clicks off on the fact that I have read and agreed to the Optum Bank terms and conditions. Once again, they are the custodial bank, and there is yet an additional form that needs to be filled out on their behalf as well. Okay, now I must make my relationship with Lasso Healthcare correct. And it says, just to retype my first and last name. Okay, and I have read, okay, and this is a little bit longer form, but again, it will help you understand, just understand what's there, about what Lasso's responsibility is, what their responsibility is with Optum Bank and with your client as well. And as long as I have agreed to all this, you can see that it is already clicked off and on the fact that I have read and agreed to the Lasso terms and conditions. And I can sit there and at this point, I can submit my application. And at the bottom, you can see that there's 2 PDF files. The pre-enrollment checklist, we need to click off on that, as well as the summary of benefits that need to be, the pre-enrollment checklist needs to be followed and adhered to. The summary of benefits, again, needs to be left with the client, that they get an idea of what they're signing up for as well. And basically, I would hit submit my application, and as you can see, it is submitting. And this is where I'm going to get a confirmation number. And we will go there. And it says here at the top, it says you have errors and have not successfully completed the enrollment form because of the Medicare number that I put in there. So we're not going to go any farther than that, but that's the simplicity of the electronic enrollment for Lasso Healthcare. If you've got any additional questions, feel free to give us a call during normal business hours at 888-780-7676. I hope this has been a help.